Please note this video was filmed during the COVID-19 pandemic. For the latest maternity service advice and information about COVID-19, please visit our dedicated site at www.mtw.nhs.uk/COVID-19 maternity information. All of the pain relief options that we've looked at so far don't contain any kind of drug or medication, but there are some methods of pain relief in labour that do. Grania is going to kick us off and talk a little bit about Entonox or gas and air.
Entonox or gas and air is available at the birth centres and at Tunbridge Wells and at home births. It's nitrous oxide and oxygen. It has a one-person mouthpiece and a two-way valve. It takes about 15-30 seconds to get into your system. So it's very important right at the beginning of a contraction that you start breathing Entonox. So as soon as you feel the contraction starting, you put the mouthpiece in your mouth and you breathe in and out, all the way up, over the top and down the other side. At the point where you want to stop breathing it, you take it out of your mouth and you breathe air. Entonox can actually, because of all the mouth breathing, it can actually make you feel quite thirsty, so it's worth having maybe a sports bottle of water near you so that you can sip water whenever you want to. Also worth having a lip balm with you to keep your lips moist.
Grania is now going to talk about another form of pain relief that contains medication, and this is called pethidine.
Pethidine is an opiate and it may be offered to you as a pain relief in labour. It's given as an injection either in your thigh or your bottom. And you can have 2 separate injections of pethidine in your labour. And in many instances, it allows your body to catch up with itself. And those people that have been so internally tense that has been out of their control, their body is then allowed to relax and the cervix can often do some opening in that time.
The final method of pain relief we're going to talk about is the epidural. The epidural is described as being the most effective form of pain relief, as it numbs you completely from the waist down so that you can't feel the pain of contractions. An epidural is performed by an anaesthetist, so it is therefore only available at our delivery suite at Tunbridge Wells Hospital. So if you start labour at one of our birth centres or at home and decide during your labour that you'd like to have an epidural for pain relief, then we'll arrange to transfer you over to delivery suite. Our anaesthetists are present and available on delivery suite 24 hours a day, 7 days a week. As soon as you asked us for an epidural, an anaesthetist will get to you as soon as they can. When you decide that you would like to have an epidural, your midwife will discuss the pros and cons with you and will also give you one of these epidural information cards for you to read. This gives you all the information about some of the common and not so common side effects associated with epidural. Some of the most common side effects of an epidural is that it drops your blood pressure, which could make you feel quite dizzy or lightheaded, and also that it doesn't work quite well enough, so you need other forms of pain relief in labour. So once you've had a read of the epidural card and you're happy that you would like to proceed with the epidural, the midwife will start collecting all of the equipment that you see here that is needed for an epidural. One of the first things that your midwife or a doctor will do is insert a cannula or a drip into your hand. Once this is in your hand, we can use it to give you fluids directly into your vein. This will help to stop that drop in blood pressure that we talked about, and also can help just to hydrate you during labour. The epidural medication runs through this pump, and we'll talk a little bit about this later on. If you're ready to, they'll continue with the procedure and they'll talk you through everything that's going on, and they'll ask you to stay as still as possible, just for a few seconds. Once the procedure is finished, a thin tube is left in your back, and this is where the medication is fed through. As we mentioned earlier, the medication will run through that tube and through this pump. You will be given this button where you control how much of the medication you receive from the epidural. Every time you feel any pain or discomfort, you press the button to give yourself a top-up. The machine is programmed so you can only deliver medication every half an hour, so you can't accidentally give yourself too much. Our epidurals are called mobile epidurals, which mean they affect your legs to a lesser degree than your sort of classic epidural. So you can still walk around and move around the room, keep upright and mobile in labour, and change your positions regularly with an epidural. But the epidural and the top-ups work as like a cumulative effect. Every time you top up, it builds the medication up a little bit more. So if your labour's quite long or you've had a lot of top-ups, then gradually the ability that you have to move around becomes a little bit less. In the same way, the epidural can gradually reduce your sensation of needing to pass urine, and if this is the case, then we may offer you a catheter in your bladder to help drain it for you. Sometimes the sensation also of needing to push your baby out can be a little bit more difficult when you're feeling quite numb, but we can help support you with this if needs be. We have a great section about pain relief in labour on our website, so please check it out and also have a chat with your midwife about your pain relief options. If there's anything in this video that you would like to discuss, then please contact your midwife.